Welcome to Wildlife Rehabilitation from Rescue to Release, a podcast dedicated to licensed wildlife rehabilitators and the veterinarians who support them. I'm your host, Gail Buell. Techniques we discuss here are meant for licensed wildlife professionals. If you aren't licensed and trained for wildlife rehabilitation, do not attempt to rehabilitate any wild animal. If you do find an injured wild animal, a wildlife professional can recommend next steps. We'll tackle topics about rescue, care, management, reconditioning, and releasing wildlife found in North America. This is a deep dive into each subject. We hope to give rehabilitators information they can use because they're already going to great lengths to rescue and nurse animals back to health. There are three possible outcomes in wildlife rehabilitation: release, euthanasia, and placement. An injured or orphaned wild animal's journey to restored health and independence is delicate and complex. We draw techniques and expertise from many disciplines. Many animals brought into rehabilitation cannot be saved. The last gift we can give them is humane euthanasia. We will talk more about when this is necessary. Sometimes animals are deemed non-releasable and evaluated to be suitable for a life in captivity. When that happens, we shift to a long-term approach to managing their care, training, and housing. These animals serve as ambassador animals, a term for the animals that rehabilitators use to educate the public. Each episode, we'll speak with experts who represent specialty topics across the profession of wildlife rehabilitation and ambassador animal care and management, showcasing best practices. Today, I am talking with Stephanie McMahon and Renee Schott about a subject many of us have heard about, but maybe a little unsure of, and that's compassion fatigue. What is it? What is it not? Let's get into it and find out. I want to introduce Stephanie McMahon. She is the board chair of Aspen Valley Wildlife Sanctuary in Ontario, Canada. Hey, Stephanie, do you want to tell our listeners a little bit about yourself?
Sure, thanks for having me. So again, my name is Stephanie. I'm board chair at Aspen Valley Wildlife Sanctuary. I've been involved in wildlife rehabilitation since 2012. Prior to that, I worked in shelter environments and veterinary medicine in some capacities. And my day job now is I'm a therapist.
Awesome. Great combination of skills there. And we're going to be exploring a little bit of that. The other guest we have today is, and I'm going to say it, a really good friend of mine, Dr. Renee Schott. She is the medical director for the Wildlife Rehabilitation Center of Minnesota. Renee, you want to give our listeners a little bit of introduction to yourself?
Yeah, thanks. Thanks so much for having us, Gail. As Gail said, I'm Renee. I'm medical director at the Wildlife Rehab Center of Minnesota. We're the largest rehab center in the world. So we do see over 19,000 animals a year. So very large numbers, sort of assembly line type operation. I've been in the field of wildlife rehabilitation for almost 20 years. So I started as a rehabilitator, then went to veterinary school, got my license, and now I'm a wildlife veterinarian for the last 12, 13, 14 years. I lose track. Yep.
Easy to lose track in this.
Yes.
It really is. Well, the reason that I have both of you on today is because of something that you guys are working on together, and a topic that is a very interesting topic and very timely topic, and also something that we have to all be very, very aware of, and that's compassion fatigue. So I was wondering if maybe you could chat about, and whoever wants to go first, maybe Stephanie, on how you and Renee got together to say, hey, this is a subject we really want to delve into.
So Renee and I met, it was a podcasting workshop by a trauma therapist where he was teaching how to start a podcast, and everybody was saying, what they wanted their podcast to be about. And I was like, well, I want to touch on compassion fatigue and wildlife rehabilitators, burnout, that kind of stuff. And Renee was taking the workshop at the same time, and she was like, hey, me too, let's touch base. And we went from there.
So after Stephanie and I met up virtually and started chatting with each other, we realized we had met each other before. We had seen each other speak at NWRA and other conferences. So it was really kind of a good example of a small world.
Oh, it certainly is. And wildlife rehabilitation in particular, but yes, it is. And I think it's also almost always 6 degrees of separation, that phrase. It just seems to resonate. Oh, that's wonderful. And then you saw an opportunity and you capitalized on it, which is you're open to that opportunity. So you were wanting to work on this area. Now, Stephanie, I know that you're a therapist, so that I can certainly see that path, right?
Straightforward.
Straightforward. How you were interested in maybe starting a podcast about compassion fatigue and burnout in wildlife rehabilitation. But Renee, where does your interest come from?
Yeah. So I'd always been interested in compassion fatigue and mental health of wildlife rehabilitators just because I saw it obvious. I think my second or third year as a rehabilitator, I went to NWRA and was at this workshop where they introduced the topic. And it was just this mind-blowing thing of, oh my gosh, this is a thing I've been feeling. I could put a label on it and understand it better. Not much happened then. This was, a while ago, and there wasn't that much in the literature. It was most like acknowledge it and hug each other. Yay, right? Fast forward to now, it was the year before COVID, and I was burning out super hard. I had been in my job for over 10 years, and it was catching up to me. So COVID hit, makes everything worse. Ran into therapy, and that sort of opened the door of personal interest. Stuck at home, I watched every single lecture or workshop I could on trauma, on compassion fatigue, on anything that could make those in our field more susceptible to this, because we don't see it in some other fields where they're not interacting with those who are traumatized all the time. So it was to me, it was like, why are we getting it and they don't? How can we prevent it? How can we make the field more sustainable? Because I did not want to continue burning people out and watching them leave. I want to keep people in this field long term.
Right. So let's explore that just a little bit more, if you're okay with that, about why being an animal rehabilitator or an animal carer, and it could be for shelter animals too, because that's very similar. But sure, in particular, wildlife rehabilitation kind of makes us more, I don't want to say susceptible, but maybe particularly susceptible to this.
Yeah. So there's a couple of different ways you can take this. And the first is, I guess, not scientifically proven, but more my observation, which I think we could do a study and it would be proven. But why do we get into this field? So let me ask you, Gail, why did you first become a wildlife rehabilitator?
Because I wanted to get into vet school.
Okay. Why did you want to be a veterinarian?
Because I was very interested in animals. And so I needed to do some work with veterinarians. And so I ended up at the wildlife clinic and at the Raptor Center and learned how to take care of animals. And that's how I landed. And I think germane to my journey is that I have a degree in biology. And I've done a lot of field work and certainly been immersed in things like natural history and life-death cycles and things like that.
Do you remember why or how you felt that calling to take care of animals?
Yes, I've loved animals, so wanted to be around them and really liked to, I watched what the veterinarians did with my grandparents' cows and thought it was very, very interesting. So I was interested in the science of it, but I was also interested in being around animals. And then that extended to wildlife once I started volunteering. And then, of course, that was challenging because in wildlife rehabilitation, of course, a lot of these animals come in very, very broken. And they were either dying in care or needed to be euthanized. And then being very sad with what people will do to animals.
Yeah. And your story is very, very common. I think if we talk to most wildlife rehabilitators, a lot of them are going to say that they first they've always loved animals from a young age. They felt this really special connection with animals and wanting to help animals. And then that sort of evolved. And then, some sort of story of natural history or nature or something, right? But that's sort of stemming from the childhood. What I tend to see in most people I interact with is that wildlife rehabilitators tend to be highly sensitive. So there's a term called highly sensitive person. You can take this test and see. So we're very acute to everything around us. We watch all of the little details and really process it very deeply. And so that makes, when we work with wildlife, we're really good at watching their states. Are they in pain? Are they not in pain? What are they doing? Finding that to go wrong. We're also highly empathetic. So we're able to really connect to that animal and say, wow, you look like you're in a lot of pain. And you can almost feel that pain in your body sometimes. And so those two things tend to really, the things that make us like animals also led us to be in this field, but those are also some things that predispose us to having compassion fatigue, because this field is so ripe with euthanasia, like you said, and seeing these traumatized animals. So not only every day are we witnessing the severe suffering of these animals, which we really sort of absorb, right? And we take it on, and it's really heavy. It feels heavy. But we're also tasked with euthanizing them and ending their suffering. So we're the only helping field, animal caregivers in general are the only helping field in which we are tasked with ending the life of the thing that we are caring for. Talk about a huge moral injury, right? Yes, we want to end suffering, but somewhere deep in our core, killing an animal is wrong. And so we have this sort of internal unconscious dialogue that's going on a lot. And unless you're actively working with that, that can slowly eat away at you as well. So that was a lot of a lot of stuff.
That was
I want to build on that a little bit, though.
Please,
yes, please,
Stephanie.
So one of the things is being highly compassionate and empathetic makes you really good at your job, right?
Yes.
And when you're really good at discerning, is this animal in pain? Is this animal scared? Is this animal whatever? Yes, it takes energy away from you, but it makes you very effective, and you can see that you're making a difference, and that's rewarding in and of itself. And in terms of also going back to the euthanasia aspect, sometimes these animals are in care for months before euthanasia is called. So you're caring for this animal and you're connecting with it. To have to make that call is very difficult, especially, and again, going back to the moral injury, if we had different circumstances, this animal maybe could be saved. If we had more resources, if we had, if this was a dog or a cat, if this was, if non-release was something that we did, right? Part of that is making that call and saying, okay, what's best for the animal?
So I find it very interesting that yes, and I 110% agree with you, especially those animals that have been in care for a long time, and then you see that they're not going to be releasable or have chronic pain or whatever, and then the decision is made to euthanize. How does we're going to define compassion fatigue here in a minute for everybody, but how does what happens in wildlife rehabilitation compared to the care or the carer system in shelter care? How does that compassion fatigue compare or contrast?
One big contrasting thing is that our patients hate us. When you're
some shelter animals will hate you too.
That's true. But usually you can eventually get on the same level as a dog, and you can give it comfort and talk baby talk, and then eventually pet it and really offer it comfort that way. And that works to feed us as well. Like it really kind of fills our cup. But with our patients, we can't do that. And if we did, we'd scare them more. So not only are we caring for this animal every day, which is, our mission, what we want to do, but every time I have to physically go and care for that animal, it hates me. So now I have to watch it be stressed out, yell at me, try to hurt me, all those things, even though I'm trying to help it. So like it's like every day I have a slight re-traumatization of working with that animal.
Right. Well, thank you. Thank you for that. Stephanie, do you have anything to add about kind of that
Yeah, I
comparing
think in
contrast?
terms of similarities, it's the demand, right? So for a lot of shelters, it's this feeling of just never being able to get ahead. There's just the demand is so great that it feels like whatever you're doing sometimes might just not be effective, that you're not making a difference because all these animals keep coming in.
Right. Right.
That unconscious feeling of not being enough is also ingrained in a lot of us that enter this field. And so when you get into that high demand, low resource situation, scarcity mindset kicks in and it keeps poking that part of you that doesn't feel like you're enough as well.
Boy, does that resonate with me.
Yep.
It's never enough. It's never enough. Oh yeah, we'll get into more of that, I think. But before we go on, would you like to, in your own words, define compassion fatigue? Stephanie, do you want to go and define compassion fatigue?
Yeah, so the way that I like to describe it, and whether or not it's 100% accurate in the literature, debatable, but I see it as running out of empathy, where you give so much that you just can't give anymore, or you can't feel it anymore. So you start to be ineffective because you don't, why? Why do this? I don't want to. Or you get irritable with your coworkers and that kind of thing. But it's really just, I have nothing left to give and people are still asking me for things.
Mm-hmm.
Yeah, exactly. And that's perfect. And a lot of the people who study this field want to reterm it empathetic distress or empathy fatigue because it's really that empathy. And to help with that, maybe we could define a few terms. So I like to start with sympathy because it's kind of tangible. It's easy. When a friend of a friend dies, you send them a sympathy card, right? And so sympathy is the feeling that you feel bad for them. So you send them a card. Easy, quick, doesn't take any resources. You feel bad, but you move on, right? Might be a little superficial, but still, it doesn't have that deep seated in your heart, in your stomach. It's just like, yeah, that sucks to be them. So you send your sympathy card, you move on. Then compassion is the feeling of wanting to help. That's it. So the feeling of wanting to help. So again, that is just that superficial feeling of, dang, that animal is in pain. I really wish I could help it. Not deep in your soul, deep in your stomach, deep in your heart. It's just like, I want to help. Empathy is that deep in your soul, deep in your stomach, going and helping and then feeling what they feel. So sometimes we can lose ourselves in that, or those boundaries get mixed. So you see that animal with a broken limb and suddenly maybe you have an ache in your arm or a really big pit in your stomach or some tension in your chest, or maybe it's busy season and your GI symptoms get worse. Or right now, just describing this, I could feel all my peripheral nerves like tingle a little. Like they're like, ooh, what are we amping up for, Renee?
Right.
So it's really feeling what the other one feels and being in it with them.
Is that where, I mean, when you were describing that, I was thinking about the commercials I see on TV showing the animals that are the dogs that are chained out in the middle of the wintertime, and they're trying to solicit for money to try to help with the rescue of them or feeding them or whatever. And of course, there's the music and the narrator and everything. Are they trying to pull on my sympathy? Are they trying to pull on my empathy? Are they trying to pull on all of it?
They're trying to pull on all of it, but specifically empathy. It's kind of like you gain up, but empathy is that one that's going to make somebody do something because it physically feels negative. It feels bad. And so you want to fix it. So yeah, they're trying to pull out that empathy string. If you watch those commercials for hours, you will go into compassion fatigue.
Yes.
They become much less effective after a period of time.
Yes.
Oh my goodness. They are very effective at doing that.
Yes.
And for certain types of people, right? The empathetic doers, the people who are saying, oh, I really feel sorry for them and I need to do something about it.
Sure.
So here's my money. Or, I'm going to go out and volunteer with my wildlife rehab. I'm going to volunteer with my animal shelter or whatever the commercial is about.
Sure. About how many people, and feel free to pull me back into things that you are wanting to explore with this, but is there like a percentage of the population that are generally fits in this category?
Fits in which category? The
That
empathetic,
is like
highly
empathetic.
the highly, yeah, I think you can correct me if I'm wrong, Steph. I want to say it's 20% of the population is considered highly sensitive.
I don't know the actual number.
Okay.
I'll take your guess. That's
the researcher is Elaine Aaron, and she came up with the term and really defined it and did all the research on it. And yeah, I believe it. I want to say it's 20%, maybe in some studies a third of the general population.
Okay. I was just curious because not everybody goes into things like wildlife rehabilitation or shelter care and or even human medicine or human care or those kinds of things. And I would assume that those types of professions also draw from that sector of the population.
Definitely. So, yeah, for sure. Right. There are a decent number of studies on nursing in particular in compassion fatigue. And so compassion fatigue is the running out of empathy, like Stephanie said, and the sequelae or the sort of the symptoms that we assign compassion fatigue are because we are out of empathy, but we're still put in a situation where we normally would try to be empathetic. And so we're running on empty. We have nothing left to give. And so what happens in our internal states, we have two options. One is to go into fight or flight. So this can be you become suddenly overwhelmed with really sneaky big feelings. And some of us are really good at compartmentalizing them and hiding them and having our straight face, but we still feel them internally. Some people don't, and they express them. And so if people go into rage or get really angry or overreact, quote unquote, so that fight or flight is a phase we can go into. But then the other state that we could enter instead is freeze. And freeze is a dissociation. And that's where we lose all ability to be any sort of empathetic. We become apathetic, unable to have emotions, and we dissociate pretty much. So we kind of walk around like a zombie. We're not working as quickly. We're really not considering the animals, their welfare, or anything. So our work goes down, the quality goes down. Our relationships will suffer because we've lost that ability to really connect. And so that's at the extreme, right? It's a gradient, and we're going to be slowly, kind of crawling to that the longer we ignore our symptoms. So fight, flight, or freeze are the resulting things. And a lot of us will, instead of, just jumping into overt depression where I can't get out of bed, we're going to try to cope, which is, healthy to cope, but it can turn unhealthy if we're not dealing with those underlying issues. So we can overuse substances or alcohol or eating. I'm an emotional eater. I definitely abuse that. We can abuse TV, scrolling. There's just a lot of different things we can use to cope. And when we overuse those coping mechanisms, that's when they can become detrimental to our overall health. And that's when it becomes unhealthy.
Right. So, Stephanie, when we get involved, so I got into the wildlife rehabilitation as a volunteer, and then I got my own permits and all that, those kinds of things. How does this, we talked a little bit about how it might sneak up where we now are running on empty, but there's a process to get to that point. So how does that, I know some of that, right? For me in my own life, it's been not so much the euthanasias, especially on admit, but a lot of it has to do with finders or people who just they do bad things. I don't want to say they're bad, but they do bad things, or the way I interpret it to be, and that they don't care. And they're making all these anthropogenic things that are happening to wildlife and climate change and all this stuff trying to help. So that's kind of me, but how does this slowly infiltrate you?
Okay. So, well, like you said, I started, probably you loved animals, you really wanted to help, you wanted to get involved. So you started volunteering.
Mm-hmm.
So you get involved, you're very passionate, you're engaged, let me help, let me do more. I can't get enough of this kind of feeling. And then you're going to get your own permit. So you're building on top of whatever you've already learned. You're enthusiastic, you're going the extra mile. And then at some point, some people just kind of get on your nerves. So maybe it's the finder that kept this animal for too long and should have just brought it over when they found it. And now it's bloated and, has diarrhea, and now you have to try to fix it. So if you get a few of those, start to get irritated. At some point, after you get irritated, or even it's not a straight trajectory for everybody, you'll start to withdraw. Maybe you don't answer the phone anymore. Maybe you don't want to do it anymore. Maybe you withdraw completely from the field. Maybe emotionally you withdraw. So you take them in, you do your thing, you change the bandages, but doesn't bring you the same kind of joy that it did before. So that's where that compartmentalization kind of comes in, where you just don't really feel it. You're doing it and you're put in these situations where normally you would enjoy doing these things and helping, but maybe the demand is too great. So some things get irritating, some things you just want to withdraw from, hide. Maybe you're using other coping like substances and that kind of stuff. And then eventually you kind of get to the zombie phase where you're not really effective. You're just going through the day-to-day. Most of us have worked with people who are just checked out. They don't care. Their decision-making is compromised. They're not effective at their job anymore. And if that person's on top of you making decisions and you feel trapped, then it's easier for you to kind of fall into that hole as well, because you're not in a position to make the changes needed to kind of get back to the passionate part. So those are kind of the steps of how somebody would get to that situation.
Sure.
And there's so many different ways and factors that go into this, right? So that feeling that volunteer had when they were helping animals, that might have stemmed from some attachment wounds or childhood trauma. So instead of attending to those wounds from their past, they just would feed those wounds by going and doing wildlife rehabilitation. Well, it's a nonprofit and it's a good thing, and this is a good thing. Yeah, but then the deeper you get into it, the deeper you realize you can't fix everything, all of these traumatized animals you're exposed to. So, I mean, that's one way that it can kind of affect us. The sheer number of traumatized animals that we see is a secondary form of PTSD. Like, you can get PTSD from all of the trauma that we see in these animals. So there's that kind of factor that goes in. The sheer burnout. So during busy season, are you sleeping enough, eating enough? Do you have too many animals to care for? So burnout is just when you run empty on something, and that can happen in any career or any part of life, right? You running empty on sleep, on nutrition, on family time, on whatever you need. And then
I think burnout is a pretty good thing to touch on as well, because it's not necessarily compassion fatigue or burnout or secondary traumatic stress. It can be all of these things or none of these things or a combination of them. So it's really not as straightforward as just compassion fatigue either.
Yes, definitely.
And I was going to ask you if they were the same, and they're not. So they might overlap, but they're not the same.
I mean, technically, you could probably call compassion fatigue a type of burnout.
Okay.
The definitions have been a little redefined. It started out in like 1993 when compassion fatigue was first brought up in the literature, and people argue a lot about whether we should change the name and what category it belongs to, and is it the same as all secondary traumatic stress? Is it different? Is it the same as vicarious trauma? So, I mean, there's a lot of different labels we can put on it, but whatever label you put on it, as long as you understand the process that got you there, your dispositions to things, and then your path to healing, I think those are the most important things.
Okay. That certainly makes sense. So I know a little bit more about compassion fatigue now, and certainly you see it a lot, right? Right now, you see it a lot on Facebook, all kinds of social media platforms. You hear about it even on the news, even if it's not obviously directed at wildlife rehabilitators. Okay, so now I know about compassion fatigue, and I'm like, well, I wonder if I quote unquote have it. How do I figure that out? And if I'm deep into compassion fatigue, would I even figure it out? I don't know, Stephanie.
I think that depends on your level of self-awareness. So some people can sit back and say, okay, am I passionate about my work? Am I passionate about what I'm doing right now? And if not, where am I on that scale? Have I been eating? Have I been sleeping? Have I been taking care of myself and the whole like self-care thing? But it's not just that. So sure, you can do some self-care, but if your work environment is so stressful that it takes everything you have out of you and you have nothing left at the end of the day and you don't know how to claw your way out of that, then that's where you would probably need some extra help. But you need to have the self-awareness to sit back and say, how am I doing? How am I doing right now?
Right.
You might talk to your friends, your family, your coworkers, and ask them for an honest assessment. And then there is an assessment you could do yourself called the Professional Quality of Life Assessment. That is a self-test that you could take every week. And the trends might give you a clue to how you're doing, along with, talking to people, or go get a therapist and ask them, right? They're a nice sort of objective outsider to take your experiences in your own words and sort of give you that assessment of, no, that sounds healthy, or it doesn't sound very healthy, Renee. What are you doing?
Well, hopefully we can have a link to, what was it called again? The Professional
Quality of Life Assessment.
Thank you.
That, yeah.
Okay, awesome. So that will, because I do want to give some resources for folks to explore later on and beyond the podcast. So maybe I take that little self quiz and I'm like, maybe I need some help. How do you're going to walk me through all of this. So how would I then find a therapist?
I can comment on that because I'm opinionated on a lot of stuff.
That's what we love about you, Renee.
I'm biased in that area, so go ahead, Renee.
I've been to see several therapists throughout the years. One thing I didn't realize is that most people take 3 to 5 therapists till they find one that's a good fit.
Ooh, yeah, really good to know.
Most of us from the Midwest, we feel like if we dump our therapist, we're a bad person. Your therapist is going, no, I don't care. Like, that's fine. Go find a better fit. Like, they're more self-aware to be fine with it. So if you don't like who you're working with, find a new one. The second thing that I think is really important, cognitive behavioral therapy is what most therapists work with. And it's a great modality. And if it's working for you, great. But a lot of us who are highly sensitive, highly empathetic, very smart, because to be a rehabilitator, you have to be pretty darn smart, right? Very smart, have figured out all of the sort of CBT hacks to get through this. We've learned how to compartmentalize, even though we don't do it super healthy. We know how to reframe. We've tried gratitude journals, like all those little things. So a lot of times going to I don't mean this insulting stuff, but just a CBT therapist can be really frustrating because you're like, I don't know what's going on and this is not helping me. You start blaming yourself, like the therapist isn't helping, so it must be me. Right? And so what I found really helpful was to find a therapist who's trained in trauma. And so this can look like many different forms, but really integrating the body. So somatic therapy. So I see a somatic experiencing practitioner, and that really helps integrate the body and the mind, which helps work through the trauma. So when we endure some sort of trauma, this can be big T, like you got into a car accident, or this can be a small T. You're a little baby and your parent does not respond to your cries fast enough. That's still traumatic. That's super traumatic, and that's wired into your brain, and it keeps repeating this cycle. your nervous system holds all that trauma that you haven't resolved. Nobody's taught us how to resolve this trauma. So a lot of us have these loops and cycles in our unconscious and in our nervous system that keep trying to repeat it over and over to complete it. But we're so good at compartmentalizing and cutting off our body from our mind. We're like, that's not helpful. I really need to stay in my cognitive mind and help this animal right now. But that just makes it worse and worse and worse. So these type of trauma practitioners are going to work with the unconscious, your nervous system, and get that trauma to resolve. So somatic experiencing practitioners is one, sensoromotor psychotherapy is another. EMDR is one that Steph is trained in, and that's a really cool technique that also helps resolve that trauma in you. And once you can get your nervous system on board and on track, then everything else really falls in place and comes really easily. You don't have to fight every day, every conflict, every, this or that, whatever you're struggling with. It just kind of all falls in line. The beauty of all these modalities is that you don't relive your trauma. That is specifically re-traumatizing. And most of us don't remember. I don't remember when I was a baby and my mom didn't come fast enough. So it resolves it in a very gentle, safe, and nice way that you don't have to relive it. Most people don't want to work on it because they'll have to relive it. No, that's specifically not what you want to do, right? So it's really, they're very nice modalities. So that's my recommendation, is to find a trauma therapist. Even if you don't think you're traumatized, you're probably traumatized. And then that can really give you leaps and bounds in a shorter amount of time.
All right. Excellent. Thank you. So Stephanie, your modality, let's talk about that.
Yeah, I do a combination of CBT. So CBT as necessary, but what I found in my trauma work, which is mostly what I work with now, is trauma. It just wasn't enough. Changing the way that you think about something didn't feel right for some of the people that I was seeing. And I do work with quite a few people in helping professions where it really is kind of the world or the system. It's not the way you think about it. These places really are horrible. So it's one of those things where I just didn't feel like the CBT was quite enough. The other part of that, so I do EMDR as well. So I move.
And I'm going to have you define both of those things for everybody.
Yeah. So cognitive behavioral therapy kind of goes based on what you think affects how you feel and how you behave. And they're all kind of interchanged and trying to break cycles in certain areas. So if you do something differently, then maybe you'll feel differently and you'll think about things differently and you'll start to feel better. And breaking those cycles kind of in one of those three areas. EMDR is more about going straight to the nervous system part of your brain. So kind of what your brain does when it's sleeping is it files away your memories for the day and kind of unhooks the emotions from certain memories. EMDR does that in kind of a targeted way. So you do it while you're awake. It can be uncomfortable, but it works through the body sensations that a lot of people tend to ignore. You can reprocess cognitively, but it's, not something that most people do. It's more a body-based therapy. So in terms of Renee's suggestion for a trauma therapist, I would second that. Specifically, if you can find someone in your area who has training in, some kind of body-based therapy, as well as some experience working with animal caregivers or people in helping professions, nurses, that kind of stuff. So they understand the environment. They understand, you can't just go to anybody and be like, oh, I'm a wildlife rehabilitator, and have them understand what your job entails. And you start to describe that to some people and they're like, oh, yeah, okay.
What is that?
It must be so nice to play with animals all day or to take care of animals. And yeah, I understand it's hard work and probably long hours, but the actual, stuff that you see as a wildlife rehabilitator is not something I think comes to mind for most people unless you've been exposed to it. So I often will tell people to seek out someone who knows something about an animal care field. So there are therapists out there who have worked in animal shelters, wildlife rehab, vet clinics, that kind of stuff. So those people are kind of well versed where you don't have to go in and explain why your job sucks. Why you're burnt out
already. Right.
Yeah, why you're burnt out, why you feel this way. And oh well, maybe you just need some gratitude journaling. Okay, but that's not going to fix the lead poisoning I see 800 times a season. That's not, I can meditate all I want, but that's not going to fix how I feel about this. Meditation and journaling and all of that stuff has its place, sure, but it's not the self-care that the average person might need.
And to be fair, I do those practices, and I'm sure most of us do, like journaling and meditation. Like, these are great practices, but they're adjunct to the pillar of trauma therapy. You have to have that base of groundedness before you can add in those things that really help. Otherwise, they could do more harm or just not be fruitful. So you really need somebody guiding you on, I think, guiding you on that journey to know when is the right time to start meditating, when is the right time to journal, and how you should journal, to have those.
I think it's important to point out too, like when you're burnt out, you don't need a to-do list of extra things on top of the stuff that you're having trouble doing.
Yes. Oh, boy, do I. Yeah, both Renee and I are like, yes, that's right. You hit the nail on the head there. Because if I'm burnt out, oh my gosh, adding one more thing. Are you kidding me? Are you kidding me? Now I'm supposed to find the time to meditate for 10 minutes. Really? No, that's not happening.
Exactly. And so there's a huge difference in what you want to do in the moment when you're in crisis, right? And not doing well. And then the things that you can do in preparation for next season when you're feeling better and have a little more bandwidth. And that kind of bleeds into that self-care, or no BS self-care is how Steph likes to call it, where you prepare to give yourself more resiliency and capacity for next year. And then what are some crisis intervention tips for when you're in the middle of baby season and it's crazy and you're about to punch the next client.
Right. Well, before we get into a little bit more detail on self-care, I wanted to stay with kind of figuring out a therapist. It does sound to me like one of the things that you should do is actually interview your therapist. You want to find out if they have had experience with caregivers, whether it's in the nursing field, doctor field, hospital field, or whether it's in the animal field. So that's certainly one question. Are there other questions that I should be thinking about if I'm interviewing a possible person to help me?
Let's take it back a step, because most people get stuck just figuring out where to start.
Yes.
Like in America, at least. In Canada, maybe it's a little easier. But here you have your insurance plan, and then you have to find a therapist, and then you have to find the right therapist. So there's not a really good, easy way to do it. So at least prepare yourself to know that this is going to be a thing that takes you a while. So sit down one evening, Google therapists in your area, psychotherapists, therapists, whatever, and start reading their bios. And in their bios, they should write a little bit about themselves. They should write the modalities that they're trained in. And you can sometimes get a good feel of if that might be a good fit for you, and look for those body-based modalities that we say. And then if you think they might be a good fit, you go back to your insurance, check if they're covered. And if so, see if they have room to take on new clients. Another way is to go to that modality that you're interested in. So I could go to the Somatic Experiencing website. They have Find a Practitioner. Click on that, find people in your state, see if it's covered by your insurance, and kind of go from there. So you can spend many evenings scrolling through therapists, reading bios, and it's gonna feel a lot, but just prepare yourself for that. Come up with a list of 5 to 10 people. And then I think if they're accepting clients, to go to your interview is the great next step.
Okay. Thank you for that. Because yes, you're right. Insurance in the U.S. For Canada, is it what would be the process?
So we are covered, like if you have benefits through work, some of us are covered through insurance plans up to a certain amount, depending on what your employer's a benefits plan looks like. Most people would be pay out of pocket. So you would have to pay per session. Same idea where you can go to, if you're interested in a specific modality, you can go to the website that licenses those people and trains those people and find a practitioner. Psychology Today is another one. You can go and review the bios and profiles of people in your area, that kind of stuff. Recommendations from family or friends. So if you kind of throw it out there, hey, I'm looking for a good therapist, some people might, tell you, this person wasn't a good fit for me. They knew nothing about whatever I was talking about, or this person was really great. They understood exactly where I was coming from, and go from there.
Okay. I'm going to throw this out there because rehabilitators aren't always in like large metro areas where there's a lot of therapists. And we also know, or at least I have heard, that during COVID, when a lot of people were definitely seeking therapy, that all of a sudden there weren't enough therapists to go around. So those complications, I'm in the middle of nowhere. There's not enough therapists to go around. The one upside of our pandemic times is that there's a lot more of these virtual or online type of possible sessions. So I think that was opportunity that a lot of people have seized upon, which I think is wonderful. So now what do I do if I'm by myself in the middle of nowhere?
Telehealth is amazing. My therapy was, for the first year and a half, was online only. And that's doing a somatic body-based therapy. So that was cool. I think a lot of the modalities have figured out how to do it virtually. Some practitioners refuse and will only do in person, and some will only do remote. So you just have to check with them and see if they'll do it telehealth. That's a great way to interview too. So you don't have to like go to somebody's office, and maybe that's a little intimidating to meet someone face to face for the first time. So maybe your first session or interviewing them is remote as well.
Okay. That's very helpful, because I think that, and I do work with a lot of people who are kind of in the middle of nowhere. And now what do I do? I'm not in the middle of the metropolitan area. So that, I think that's very helpful. So maybe let's talk about one of the things I do have to say that occurred to me about wildlife rehabilitation in the United States. Depending on your state, you have to study for an exam. You have to have an inspection. You often are encouraged to join organizations and network and all this kind of things, all these things in preparation for receiving animals, especially if you're an independent rehabilitator, right? I'm wondering if maybe a requirement for being a rehabilitator is something in this arena. What are your,
that would be a good idea. I think a lot of people are not prepared at all for what they're walking into when it comes to wildlife rehab. That's just based on what I've noticed. I don't know if it's different for you, Renee, in your facility, but I know that it doesn't happen infrequently where a lot of people seem relatively unprepared for the demands of rehabilitation and what exactly they're kind of walking into.
Minnesota I'm sorry, Renee. Minnesota tried decades ago, right? We have 3 levels of permit. And when you come in as a novice, you're only supposed to do healthy orphans because you have a really high success rate. And that's to try to give, of course, a lot of positive reinforcement and try to keep you in the field until, of course, then when you get to be a general and get to start handling injured and things, then, a lot more death and euthanasia. But I still don't think we're preparing people.
No, definitely not. The one thing that NWRA sponsored a talk by Jessica Dolce, who is an educator, and it was a great talk. You can find it on her website, or maybe we can post the link in the show notes for this podcast.
Yep.
One of the concepts she put forward, and I've just been spouting it off ever since, is that compassion fatigue is an occupational hazard of this job. It is not a choice. that you can say, no, I'm not going to get fatigued today. It's
right.
It doesn't mean that you're weak or not enough. It is something that will happen to everybody in this field. So we need to start preparing and trying to increase our resiliency and capacity before it hits us. And then when it does, we can recognize it and do the actions we need to do to climb out of that hole as quickly as possible.
So as well as having a veterinarian of record, we should have a therapist of record.
I think so. I think so. And I don't know how to monetarily justify that. We're already doing this for free, a public service for free, and now you're requiring me to go to another medical health professional regularly on my own dime. So,
I'm with you, and I wasn't being sarcastic.
I think it comes down to the tools, right? Like the PPE, right? You have, you don't handle rabies vector species without the training to handle a rabies vector species, and the bite gloves and the vaccine and the blah 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 blah. Maybe you don't get into wildlife rehab without some kind of, I don't know if it's a training course, the same as, you would go through your basic wildlife rehab, your advanced wildlife rehab, your wound care, your whatever. Well, compassion fatigue falls under maybe one of those, and it's understanding the occupational hazards of rehabilitation.
I like that. I think that's a great suggestion, because we talk about PPE, we talk about zoonosis, we talk about, how to set up, how to talk to people on the phone, all of those things. And we should be talking about this too. I think that is an excellent suggestion.
And then I think it sets it up more as that it is a choice that, if you want to take on injured and sick animals, this is your hazard. So maybe you should get a therapist and get prepared for that. Mm-hmm. And if you can't get a therapist, then maybe we stick to the healthy orphans. And then work with everybody being okay with that. That's the other hard obstacle.
And it is the hard obstacle. There's another hard obstacle too, which is there's still a lot of social stigma with having a therapist. That there must, you go to a doctor when you've broken a bone.
Yes.
Right?
Yeah. I think it's confusing because we've pathologized so much in the mental health field, which we've had to do for insurance companies, right? And to standardize treatment. So that's how you get treatment. But at the same time, then that attaches that stigma to it, that you have a disability, and that
something's wrong with you.
Yeah. And that's not true. It's a wound. Mm-hmm. That's why I always refer to everything as a wound, and it can be healed. And who can heal it? You can heal it. You have everything you need, but oftentimes you need someone to teach you how to do appropriate wound care. And so I like to reframe it as it's going to the gym. So the people who go to the gym are usually really in shape, right? And they keep up being in shape by going to the gym. You go to a therapist to keep up your mental health. Even if you're in a really secure spot, I think going to the therapist is a great idea. Mm-hmm. I think everybody should have one, and I require most people in my life to have one.
Well, there you go. That works. Now we know what this thing called compassion fatigue is. In the next episode, we dig deeper into this subject. Thank you for joining us, and I look forward to having you along. This was another episode of Wildlife Rehabilitation from Rescue to Release. We're glad you joined us today. Wildlife Rehabilitation from Rescue to Release is a production of Partners for Wildlife, working hand in hand with wildlife rehabilitators and veterinarians to improve the welfare of orphaned, ill, and injured wildlife. Our executive producer is me, Gail Buell. I'm the Partnership Coordinator for Partners for Wildlife at the University of Minnesota College of Veterinary Medicine's Raptor Center. To learn more about the Raptor Center and Partners for Wildlife, visit Raptor at umn.edu. Our producer is Kurt Clockey. Are you interested in becoming a licensed wildlife rehabilitator? Visit the National Wildlife Rehabilitators Association website at nwrawildlife.org for resources to get started. And remember, if you do find an injured or orphaned animal, please contact a licensed wildlife rehabilitator in your area. And that's our show. Hope you'll join us next time.